For ReachMD, this is Audio Abstracts. The following is brought to you by Prova Education.
Cystic fibrosis, the most common lethal recessive disease in Caucasians, affects approximately 70,000 patients worldwide and results from mutations in the cystic fibrosis transmembrane conductance regulator, CFTR. For the vast majority of cystic fibrosis patients bearing the most common CFTR mutation called Phe508del, an FDA-approved combined treatment with the CFTR corrector, null-Cftr, and the CFTR potentiator, epigallocatechin, is only marginally effective. Dr. Antonella Tosco and colleagues had previously reported that the combination of two safe proteostasis regulators, cysteamine and epigallocatechin gallate, can be used to improve deficient expression of the cystic fibrosis transmembrane conductance regulator in patients homozygous for the most common CFTR mutation. In a new article published in Cell Death and Differentiation, Dr. Tosco and colleagues provide the proof of concept that this combination treatment restores CFTR function and reduces lung inflammation in mice that are either homozygous or heterozygous for the CFTR mutation Phe508del, provided that such mice were autophagy-competent. The study assessed individual responses to cysteamine plus EGCG in a single-center, open-labeled Phase 2 trial. Primary nasal cells from patients bearing differential class II CFTR mutations, either in homozygous or compound heterozygous form, responded to the treatment in vitro. The combination treatment decreased sweat chloride from baseline, increased both CFTR protein and function in nasal cells, restored autophagy in cells, decreased CXCL8 and TNF-alpha in the sputum, and tended to improve respiratory function. These positive effects were particularly strong in patients carrying Phe508del CFTR mutations in homozygosity or heterozygosity. However, a fraction of patients bearing other CFTR mutations failed to respond to therapy. Importantly, the same patients whose primary nasal brush cells did not respond to cysteamine plus EGCG in vitro also exhibited deficient therapeutic responses in vivo. Altogether, these results suggest that the combination treatment of cysteamine plus EGCG acts on target because it can only rescue CFTR function when autophagy is functional in mice and improves CFTR function when a rescuable protein is expressed. These results should spur further clinical development of the combination treatment.
This has been a presentation of Audio Abstracts. The proceeding was brought to you by Prova Education. For more information and for reference links of this article, visit reachmd.com/audioabstracts.